Okay, once again, I want to say thank you. I want to just talk a little bit about myself to introduce, if you need to know any more. I am in the field of ABA and forensic psychology. I have a long time interest in this area. For though there are a few of us around, and it's kind of interesting that the most that I speak to have been started out in behavior analysis. I started out in forensic psychology, and I started to work at a psychiatric hospital. And to tell you a very brief story, essentially early on I began to see that our environment had a lot to do with what was going on in that hospital. And we even had the ruling, it came from the state, to stop all cigarette smoking, which was a mainstay in the hospital. Just all of a sudden stop, no smoking. Anyone on the entire hospital is allowed to smoke. And a lot of the staff thought that this was stupid, and when they would go off site with a patient, say to get an x-ray or a doctor's visit, they'd smoke, and they'd let the patient smoke too. This was going on, and so the next thing you know, you had a whole lot of patients injuring themselves trying to get one of those special trips to an x-ray or a doctor's visit so they could smoke too. And what signaled me in that this was important is how it seemed oblivious. The powers that be, the administration at the hospital, they just saw a lot of self-injury going on, and they had no idea why. And it was because of this ruling and the way that it was handled. It probably is a good idea to stop smoking, but I realized then there's a lot to be said about the environment and the learning history. And I did see a conference by the late Brian Iwata, and he talked a lot there, and I spoke with him about the hospital, and I thought, this really is critical information that I'm not sure is being shared. It was very much a very psychiatrically, as you could imagine, medical model type of facility. But I'll get into that later. But that's a part of where I started. As Dr. Song spoke, I started out at John Jay College. I graduated in 2000. It's 26 years ago. I also went to the University of Indianapolis to get to become a counselor. And then recently to me, I graduated with a PhD in ABA from Endicott College. That's in Massachusetts. And that's just looking at this, makes me realize how much education has changed in these decades. Endicott was entirely online. As I said before, 13 years I was a therapist at a forensic psychiatric hospital. That hospital has also changed quite a bit. I was a BCBA in the community, also some other inpatient settings, and also community mental health. I am the what's called the public relations director at the special interest group for ABAI, Association for Behavior Analysis International, and our group is Forensic Behavior Analysis. And I have the Criminal Behaviorology podcast for all those who are interested, or otherwise just something I do on the side. And also a group of us are part of the Crime and Behavior Analysis Academy. That's crimeandbehavior.com. We have all kinds of trainings, information on supervision, risk assessment. A lot of different areas are available asynchronously on that site. Here's what I want to talk to you about this evening. A place for forensic psychology in ABA. A lot of it, I think some good information that is recent is in this book. I found Psychology and Criminal Justice. It has a pretty good behavior analysis section on it, and also the author Leslie Blair, she breaks down the different areas of forensic psychology we might consider. Police psychology, which by the way there's been some ABA literature on that. Forensic psychology as practice. Correctional psychology also, just working in prisons. And the literature supports these different areas. Now here we have the forensic behavior analysis, a brief part of our page. For those interested in the SIG, the mission is to ensure that those in the criminal justice fields have access to appropriate evidence-based behavior analytic therapeutic resources to reduce crime and delinquency. And you can find on ABAI the listing of the many now special interest groups. Ours can be found on there. That picture has the old name of it, which was Crime, Delinquency, and Forensic Behavior Analysis. Now it's just Forensic Behavior Analysis, but you can easily find access to any one of the SIGs on the ABAI Special Interest Group page. And there we have our page, Forensic Behavior Analysis, and it lists the mission and then the description of membership. Easy enough to go ahead and sign up for if you're interested. Also, there's other avenues. We have some regular meetings that you can attend as well, whether you're a member or not, but it's very easy to sign up for to be part of the SIG. And we also, of course, like everyone else, we have social media. This is the Facebook page. This picture is from, wow, there's over 4,000 members now, and it's taken a lot of popularity, I think, from events like these and other areas, other kinds of things out in social media and some of the other conferences we've attended. A group of ours was in Milwaukee, Wisconsin, nearby Milwaukee, Wisconsin, talking about forensic behavior analysis and forensic case conceptualization, where we went through a couple of different criminal cases and developed a forensic case conceptualization. That's also, you can be found on online and then on the crimeandbehavior.com site. I really cannot capture all the different areas, and Dr. Song and I were just speaking before we got started. There's so many things, so this is just a sampling. And by the way, I think if you practice at all, and that includes with children, that you will easily encounter some areas of forensics. If we go ahead and have a broad definition and we include something, say, like, and I'll get into this a little bit later on, but something as child custody or family reunification, those are areas we can easily come across, and you may become involved in, whether you want to be or not, with testimony or other kinds of expert work. So I'm just giving a sampling here of the several different areas where ABA can be applied. Among these, of course, is juvenile justice. And I think juvenile justice is a good segue, by the way, of our application of ABA into forensics. You have a youth population, you have behaviors in a particular setting, in a particular context. You may have functional communication training, you may have different kinds of disabilities. There's a lot in common, and there's a lot to be said about how we could help out the community, which is the most important thing, and there's a little bit about how we can get our foot in the door, so to speak. I got a call from Illinois where they were setting up some group homes, about 6 different group homes, and they were going to hire BCBAs to work there, and they couldn't find anyone that was in the field other than me to talk to, and I spoke with them about some literature, some information they might want to look up, some things about contingency management work. I think there's a lot of, you never know where some of these areas will open up. Juvenile justice is a hot topic to keep an eye on if you're interested in ABA and forensics. An article this is by Mercurio and Scheinbaum Lerner in 2024, and they talked about what they described as fitness to stand trial. It's unfitness to stand trial and the social model of disability. This has to do, I'll get more into that later, but here in the USA, you may more frequently hear this as competency to stand trial, and I'm going to discuss that. But that becomes an important area, especially when it comes to learning, when it comes to doing some type of training about how to behave in court. It's also become a rather hot topic due to different legal changes and challenges around the country, and closure of mental health facilities, limited mental health access to mental health care. It's become more of an issue in courts. Something that was relatively not that big an issue before has become really important, and I'm going to talk a little bit about how ABA can help work in that area. So of these, this is the juvenile justice is seen as a segue, competency to stand trial, concepts that are essentially about fairness of sending someone to trial if they do not possess the basic skills to defend oneself in court, and they can vary in criteria from different countries and different regions, and we have different kinds of dispositions even in different states within the United States. We also have domestic violence or intimate partner violence. Sometimes this area surprises those who pursue ABA and forensics as a specialty, but I will speak a little bit later on about some of the literature involved and how we can be relevant in that particular field. There is a book by a Brandon Green. I'm going to talk about that. It's about child welfare, family preservation, and reunification. A lot of the children that have been put in foster care or separated from the family, or CPS is looking at, they can do a lot of different kinds of work about the home, working with the parents, working with the children's education. That's a hot area. Forensic behavior analysis and case conceptualization. That's some of the work that my colleagues have done. If we have a little more time, I'll get into more of that, because that can be pretty valuable in a lot of different areas. And risk assessment also. There's a lot of different areas that we're talking about. In this specific way, we're talking about analysis of violence risk. There's different kinds of risk assessment out there. One instrument's called the HCR 20. That it would be the one I would go to that I've used in risk assessment. There's some other instruments to be used, but this is another area I can see behavior analysis being pretty relevant in. Of the different literature, and this is also a sampling, and you see it, there's a lot more out there, and some people I know, they're working on a journal specifically for ABA and forensic psychology. There used to be one before, actually ABAI published it, but it was merged into another journal some time ago. But it surprises some the amount of literature that's out there directly dealing with forensics, and published in journals like JABA, Journal of Applied Behavior Analysis. Preventing Antisocial Behavior in Schools, Roy G. Mayer, 1995, talked about the security arrangements, and punitive measures are at best temporary necessities. They are not the total solution or get us to progress within antisocial behavior in schools. The next one I'll get a little more into. Eliminating the battering of women by men, some considerations for behavior analysts. That's by David Myers. That's also from 95. Physical and verbal aggression described with the three-term contingency involving escape, punishment, and positive reinforcement. Socially relevant, as it is one of the most common types of violent crimes and can be easily seen as a learned behavior. Okay, this one, Prompt plus Delayed Contingency Procedure for Reducing Bathroom Graffiti by Watson, 96. Assess the effectiveness of signs posted for reduction of graffiti in 3 men's restrooms using multiple baseline across settings design. Assessment, much different. Assessment of deviant arousal in adult male sex offenders with developmental disabilities. Some well-known names in that particular article is from 2006. This has to do with the participants in an arousal assessment using the use of what's called a penile plethysmograph, and this is a measuring of blood flow when certain images are put forth. This same procedure is used in risk assessment for sex offenders. Effectiveness of trial contingency management in a felony pre-adjudication drug court. Also in JABA 2008, this involved gift certificates for compliance at different time intervals. Results indicate such a program is best suited for the more incorrigible drug offenders. Got a little bit, these contingency management programs get a little bit complicated in dealing with the other kinds of contingencies in the environment. And when we're dealing with offenders, we're talking about changing environments. Some can go from work release to just simply being on parole. Some can be in the correctional environment and then go on work release, so on and so forth. So there's a lot of complexity there that makes it difficult to do a contingency management programs, even when they've shown to be effective in some cases. Now something much different, and other names that are well known. Teaching abduction prevention skills to children with autism. This is crime prevention. 2002, Kristen V. Gunby, James E. Carr, and Linda LeBlanc. Children with autism acquired abduction prevention skills that maintained on follow-up assessments. You think about this when we talk about things like elopement or other kinds of precautions. Why are we doing these? Well, we want the children to be safe, and we don't want them to be out in the world where they could be in danger. Are there things you can do if that does happen? If they're out in the world and could they be taught abduction prevention skills? This appears to be the case. And now I think you're getting an idea of the variety of different areas we're working on. Confessions selected by consequences, an operant analysis of false confessions and interrogation techniques. This is by Nyland and Ortu. This is 2020 and Behavior and Social Issues Journal. You know, I saw another article, not behavior analytic, but another article about the possibility of false confessions and how the police may be inducing people to confess to crimes that they didn't commit. But this article is really on point. It's something we'd be familiar with, about how just the mannerisms, the procedure, the way it's done could induce someone to confess to a crime that they didn't commit. And it's already an issue that police they know they have to be aware of. But to look this as an operant behavior is actually what's going on, is why somebody might confess to something they didn't do. So this is an easy article to find as well, but it's very intriguing, and especially in this day and age there's been a lot of issue about the validity of confessions and are they done fairly, and then the article talks about ways that it could be done to reduce the potential for false confessions. Okay, this kind of literature is usually on the periphery. Most of the studies have arisen from a kind of interconnection with behavior analysis and another area of study. For example, those with autism being the victims of crime or the perpetrators. There are enough of these important socially relevant areas of study to justify crime and behavior analysis as being a distinct emphasis within behavior analysis as a field. I do recommend, if you can come across it, this is a book from 1987. If you haven't heard of this already, and the author's Brockman, and also Ed Morris. Ed Morris now runs the history special interest group, and he covers a lot, but they put a lot of work into this book from 1987, and it has some of it's a little bit dated, but a lot of it is very important information, certainly historically, about behavioral approaches to crime and delinquency. From 2020, behavioral forensic assessment case studies and concepts are described very well in this book by Rubin, and this is by 2020. I'll maybe speak a little bit more about that when they talk about competency, they talk about case conceptualization. Rubin does. It's a valuable text right there. The wider ABA field has a focus on, we'll say, autism, intellectual disabilities, but there is a need for behavior analysis in numerous areas of mental health care. Forensic mental health care in general is an area of great potential in ABA. I believe I can give some examples of why that is the case. I work in outpatient mental health care now, and I'm still seeing examples of where ABA can be applied with issues like school refusal or children and parents' discipline problems in school. You'd be surprised how many different areas at least have a kind of a connection to forensics. Okay, and these are not questions that people have to write down or anything. It's not a quiz, but I do include these kind of questions here for each of these sections just to give you some thought, give us something to consider. And what are some of the areas where behavior analysis can be applied in forensic settings? If you can think of more areas to include beyond what I already discussed, what would they be? I'd be interested. Maybe we can talk about that later. I think there's quite a few. Why would domestic violence or intimate partner violence be a socially relevant area to study? I'll get into that later on. Fitness to stand trial, is it viewed the same way in different countries? Why or why not? I'll also speak about that briefly. It varies quite a bit, and it has to do with the rulings and the laws in those different regions. And just for yourself, which articles listed in this lesson were of interest to you and why? Just something for you to consider. Well, as you know, Bear, Wolf, and Risley in '68, and they've defined the dimensions of applied behavior analysis, and we've got, you may have heard of the different acronyms. I think it's Get a Cab or Bat Cage, if you hear about that, but we know here applied behavioral, technological, analytic, effectiveness, generality, conceptually systematic. I also, Morris wrote an article in the 80s, and it's applied in that blue book you saw earlier, The 7 Dimensions Applied to ABA and Criminal Justice. And keep an eye out for generality. I'll speak about that a little bit later on. But what Morris and Brockman talk about, the inconvenience of forensic ABA application as a field in itself. In terms of the type and pervasiveness of its problems, criminal justice system may be the most inconvenient of all settings in which to conduct ABA. Cause and effect relationships are difficult or impossible to obtain. Functional demonstrations may not be permitted due to safety and other ethical reasons. Now that was written in '87. Our ability to do functional assessment has changed somewhat since then, so there may be more opportunities for that than what there was several decades ago. I just want to say on this section on fitness to stand trial, and we use the terms competency to stand trial and fitness interchangeably, although variation in concepts from region to region. This is Mercurio and Scheinben and Lerner. They worked, a committee on the rights of persons with disability has pointed out that the legal concepts of unfitness to stand trial and not guilty by reason of insanity, a completely different concept, are in keeping with accepted rights of those with disabilities. In the field of Latin American criminal law, the social model shows limited influence. Mexico and Argentina have recently incorporated procedural accommodations and support in their criminal procedural codes in this area, which is more in keeping with the Committee on the Rights of Persons with Disabilities. There's also been some work in the United States, and there's been a renewed focus on competency or fitness to stand trial in the United States based on need. The reforms that Mercurio and Scheinbaum-Lerner discussed have not led to further discussion on the concepts of unfitness to stand trial and have been in contrast with human rights standards. The result being persons with disabilities who are found not guilty by reason of insanity are sent to prison to receive treatment in Mexico. And in Argentina, they're seen by civil judges and placed in psychiatric hospital. Here in the United States, in my own state, they may have a case where they can easily have a case where a person's found incompetent to stand trial, and this can be for any charge, misdemeanor or felony, and they could end up spending more time in a hospital than they would have had they been convicted of the crime. For example, let's say you just stole a blanket from the Salvation Army, and this is a case that actually happened. He was arrested, incarcerated, found incompetent to stand trial, and then stayed incompetent to stand trial because he could never meet the criteria for competency, and that went on for a couple of years, something he wouldn't have spent that much time for if he'd just been convicted. Wall and Lee 2020, assessing competency to stand trial. To send a defendant to trial when not capable would be undignified to the process and unfair to the accused. Competency to stand trial is probably the most common forensic evaluation, at least in a criminal setting. They noted that no standardized assessment determines competency on its own. Psychiatric hospitals, due to changes in policy as of late, have reached near full capacity due to CST cases. And this particular article mentions that when the competency issue has been raised, the judge believes the defendant's capabilities are in question. The expert completing, there will be a series of experts to complete the evaluation, must have adequate clinical skills. The competency or fitness evaluations have a focus on specific deficits in the context of criminal charges. It's two basic categories, and it has to do with, can you assist in your own defense with your attorney, and do you know the charges against you and the consequences of being convicted of those charges. Those are two areas you really need to be able to function in. Standardized instruments have been suggested as a method to make competency to stand trial evaluations more effective. It is possible a defendant can be competent for one criteria, but not for another. And I think that's where behavior analysis might come in, to strengthen whatever the skill deficit is. Pinall's in 2005, competency to stand trial described as the place where the legal and clinical realms meet. If not meeting the requirements, the defendant will be opined as incompetent to stand trial. The possibility of educating defendants could be seen as less invasive than other kinds of psychiatric interventions, such as forced medications or anything like that. Between 6% and 16% of the ICST defendants are diagnosed with intellectual disability. There is a dilemma of the patient versus defendant label and whether treatment should be focused solely on competency to stand trial restoration or simply the alleviation of symptoms. I think a part of this should be developed skills. Hodge, competency to stand trial from the Indian Journal of Psychiatry. Competency to stand trial, once again, mentions a very common forensic evaluation. It is important due to the need for the autonomy of the defendant's decisions and the dignity of the court process itself. Two of the most common clinical reasons for a finding of incompetency to stand trial are a diagnosis of a major mental illness and or intellectual disability. And the National Center on Criminal Justice and Disability in 2017, two key areas of reform are suggested. Those with intellectual disability are provided accommodations as needed, and cases of incompetency to stand trial only occur where the defendant lacks understanding of the information needed to defend oneself in court, and only in cases where accommodations cannot ensure the ability to be a successful defendant. What's used in a lot of these competency cases in long-term competency restoration, that's where the person probably has remained incompetent longer than 6 months. They use what's called the McCrary criteria as a standard set of skills. Authors found that 81 defendants were incompetent to stand trial for more than 6 months. Of those, 52 ultimately were found competent. Older individuals were less likely to be restored, and those with more serious charges were more likely to be found competent. In this article, the authors found defendants who with a psychotic disorder, those with a psychotic disorder were 8 times more likely to be found incompetent to stand trial, and those with a history of hospitalizations were twice as likely to be found incompetent compared to those with no such history. Competency reports are most useful if the defense attorney and judge can monitor the defendant's behavior and the appropriate changes, consultation, and reevaluation can be implemented. For this article, they compared different methods of competency to stand trial restoration and determined education on legal rights and learning courtroom terms to be helpful in the process of restoration. When I worked in this field in a psychiatric hospital, we would have a legal education class. We'd have a large classroom of people and just go over these terms and these concepts and had tests for them. It was pretty basic education. And since that time, I've looked in the possibility of direct behavior analytic interventions. For this area, these 2 articles, I'm going to say something about discrete trial training, as this pertains to the work I did on competency to stand trial, a project in this area on CST. With discrete trial training, one may help with tacting and manding. And this was part of a thesis I did in 2024. This study took place just like we're doing now, in that it was remote and synchronous. And I had 2 subjects from 2 participants from an autism treatment facility. There are 2 males, both diagnosed with autism spectrum disorder and intellectual disability. Neither had any criminal history, and they were not incompetent defendants as such. They possessed vocal skills to tact specific visual stimuli. Literacy was not a requirement, nor was having experience in the legal system. A list here of the terms we were teaching them. I derived these from a previous class of competency when I taught at a state psychiatric hospital. Terms which are trained without an accompanying visual representation will have an asterisk next to them. And those are that for each of these that did not have an asterisk, a star next to them, we would have a card that they would tact, or we would do some matching skills with. Those that had the star, those were simply concepts that we taught with interverbal skills. More about that in a minute. They would be presented with this orientation card at the beginning of the session. The visual cards were used for matching, were placed over a courtroom diagram. 6 of the courtroom cards were displayed in turn, and a brief explanation of each role was provided when the cards were placed accordingly. So we would start out with this diagram. They would have the judge, the court reporter, the witness, the prosecutor, defendant, and defense attorney, which was the same card, and the jury, and they would place them accordingly on this diagram with some assistance as needed. So these were the type of cards displayed to the participants. Here we have a gentleman on the left who is the court reporter. The card for the defendant and defense attorney with the same visual cue. To just have an attorney would make the prosecutor and defense attorney difficult to distinguish. The defense attorney is recognizable being positioned next to the defendant. With these cards we could do a tacting exercise. With identical cards we could place an array of different terms and then have a matching card, judge for example, and could then use a positional gesturing prompting as necessary. For intraverbal, we would have the term on one side of the card and the definition on the other. The research assistant would read the term definition and the participant would then provide the answer. And just for benefit of time, this was the basic inclusion criteria. They were not required to be literate in any area of the legal history. They would have the ability to repeat words of 4 to 5 syllables, and they were able to have conversation with full sentences. A multiple baseline design across behaviors was implemented. Dependent measures were the identification of terms for 2 verbal operants, tacting and intraverbal, and matching sets. And it was, as I said, it was over Zoom meeting. The sessions lasted between 20 and 30 minutes. And this was the first participant, and he just went right through it, and he had an interest in these kind of court shows anyway. But on this particular diagram, he excelled at 80% during baseline. It did not require any further intervention. The second participant, Ted, did show progress, particularly in the behaviors of matching and tacting. Now, due to scheduling and some human resources problems, the data had periods of time with no activity. It can be seen for Ted on matching that he performed well enough in the baseline phase to no longer meet the criteria for the intervention, so he really excelled in matching. With Ted on tacting, the visual inspection of the graph displays noticeable progress, justifying tacting as an intervention to improve the learning of courtroom terms. Such data could be used in real-life cases if courtroom terminology was part of the reason for the unfitness or incompetency to stand trial. Data could be presented to judges displaying progress or continued deficits and supporting a decision one way or another based on the results of the discrete trial training procedures. For Ted, intraverbal as an intervention was also showed improved recognition of courtroom terms. Were this a real case, the defendant would demonstrate a greater recognition of the terms and would likely be better equipped to participate in his own defense, which is the goal we're trying to achieve. Limitations, I think we can go through that quickly, not just because I'm trying to avoid talking about the limitations of the study, but just for the sake of time. Limited number of participants, not measuring the cognitive abilities, and they were not defendants in criminal cases. Needed more baseline time, more staff. We just had to kind of use the staff that I could train, and having participants with different diagnoses or multiple diagnoses might better reflect the actual incompetent defendants. Discrete trial training can be useful in assisting those with difficulty processing information. Matching and tacting are especially valuable for comprehending how to facilitate the enhancement of abilities. These results are important as they demonstrate that a simple discrete trial training method could be of use in forensic cases. It is important for the defendant and the overall dignity and orderliness of the process itself. The inpatient psychiatric hospital could provide the setting and time for discrete trial training exercise to assist the defendant in comprehension of courtroom terms. Also, the outpatient treatment centers could make similar resources in terms of time and rooms available, so the defendants may not, in every case, always have to be in a hospital setting. These findings support further use and development of behavior analytic techniques as interventions in forensic cases. So why is criminal justice or forensic setting the most inconvenient to apply behavior analysis? Well, the cause and effect relationships are difficult to obtain. The functional demonstrations may not be permitted or very difficult due to ethical reasons. According to Mercurio and Scheinbaum-Lerner, recent reforms have not led to further discussion on the idea of being fit to stand trial. Why do you think this is the case? Well, possibly the legal system is more suited to process cases than to deal with the kinds of deficits that would result in a defendant not being fit to stand trial. It's really not the design of the legal system. Assistance from mental health or behavior analysis is kind of coming from outside the system. And Perilli, Gottdiner, Zopf, those with a psychotic disorder were just as likely to be unfit to stand trial as those without. True or false? And it is false. Those with a psychotic disorder were 8 times more likely to be found not competent to stand trial. And in the thesis we reviewed, one method used to assist identifying courtroom terms was essentially choral responding. And it's false, it was discrete trial training. I think other methods could be used, for example, behavior skills training or equivalence training, and different methods could be used to assist in competency cases. I do want to talk about social validity and goals in forensic settings. The validation has to do with goals, procedures, and effects. Social validity at times could be misleading. It could be manipulated. It could be abused. An example I think of is when the forensic evaluation can be a bit of a conflict of interest, where you have a psychiatrist to do an evaluation for competency that is also an employee of the state. So we get into some interesting ethical issues when it comes to working in forensic care. Caution must be taken in sampling for relevant judges, especially in cases where the values of different social groups may be in conflict. Applied behavior analysts may focus on goals they think are relevant to a social problem, but if there are conflicts of interest involved, then the program may fail. Now we want to look a little bit at the social validity of pursuing work in domestic violence. Myers, 1995, I mentioned that one before, looked at the problem of domestic violence as one would other kinds of severe problem behavior. Bell and Noggle, 2005, examined what's called the stay-leave decision, where a victim of domestic violence may be dealing with. Should they stay in the relationship, or should they leave, or do they leave and then come back? And then Bonham, Stanley, Keim, and Corbin to view domestic violence as an operant behavior. That was 2008. Now, Myers had the 3-term contingency of domestic violence, ABC. Escape and avoidance of abuse can control the victim's behavior and compliance in the relationship. The abusive person may receive positive reinforcement in the form of controlling the home environment, etc. According to Myers, the instructor will add the propensity to abuse may be reinforced by separating her from family and friends who could intervene on the violent relationship. In addition, the batterer may not receive consequences to reduce violence, or the consequences are far from sufficient. Now, the social validity of domestic violence. Models can increase the likelihood of certain behavior. Models may ultimately produce a set of rules which alter our subsequent actions. Potentially, models might increase the likelihood that physical aggression will be used to punish the victim or any of the other reinforcers for battering. Low probability of detection in spite of the fact that battering is a crime. All the legal and cultural and economic factors that may assist the batterer or fail to provide consequences for domestic violence. And here's some categories of interventions. There's assistance for battered women, there's legal and judicial interventions, intervention programs for those who commit domestic violence, and just changing of community mores. Our profession probably has not given this social problem the serious study it would require, considering the magnitude of the problem. This despite the fact that this could be seen as a learned behavior. Social relevance as an applied feature of ABA suits domestic violence, intimate partner violence. One issue that could impede behavior analysis in this area is that of measurement. The violent behavior is behind closed doors, and this could present a methodological barrier. However, the use of permanent product is one potential remedy. Measuring the effect of behavior on the environment and ex post facto data measurement. This has been done in studying the behavior of, for example, vandalism, abused and neglected children, and also industrial safety. Another means involves publicly accessible records such as police calls, arrests, charges, convictions, and sentencing data. Also, verbal responses of subjective data. The victim reports violence and or shelters, domestic violence shelters, report on the effectiveness of domestic violence programs. Now this article, in the interest of time, maybe some things I'll go over quickly, but I found this interesting because of this stay, leave, and decision. And this was by Bell and Noggle. They expanded on Myers, and they had this examination of the phenomenon to assist future partner violence prevention and treatment programs. And what they have here is the behaviors that we might see in a domestic violence case, and then the behavioral principle that matches for it. So, positive reinforcement. The victim receives praise from friends and family for returning. Negative reinforcement. Victim escapes physical abuse by calling police and leaving home. Punishment. Victim punished for leaving by encountering barriers to finding other living arrangements. Extinction. Victim continues to be abused even after separating from the relationship, and the response to leave is eventually extinguished. Behavioral deficits. Victim lacks skills to find alternate living arrangements. Rule-governed behavior. Victim who believes she must work on the relationship despite any difficulties. Choice in behavioral economics. The victim stays in the violent relationship when current relationship offers more incentives than the alternative. And also delay discounting. The victim chooses immediate reinforcers associated with staying in current relationship, and social support linked with reinforcers related to leaving the relationship, as opposed to delayed reinforcers. These are some basic behavioral economics principles, but I think these can be used to educate people, the police, the courts, of why you might have a difficulty with a stay-leave decision. Another article from 2008, assessment of contingency based on the results of their battering assessment tools. Essentially, the lack of responsibility, expressed lack of responsibility, is not necessarily a standard trait of an abusive man, and not always related to antisocial personality. Lack of success in the treatment approaches may partly be the result of inaccurate stereotype of who the batterers are. It is possible successful treatment could focus on understanding the operant contingencies in each case, which is an interesting suggestion. The prevalence of this social problem means there is data to be collected in every community. The principles of behavior analysis lend themselves to addressing severe problem behaviors intermittently reinforced. Domestic violence is one such severe problem behavior. Social validity measures can be misleading, manipulated. They can also be abused. Myers looked at intimate partner violence the same as any other severe problem behavior. What would be an example of his views on this problem? The different kinds of behavioral principles and their application, the ABC, and the three-term contingency. According to Bell and Noggle, a victim of intimate partner violence may return to an abusive relationship and may receive praise from her family for doing so. This may be an example of positive reinforcement for returning. And Bonham, Stanley, Kyman, Corbin. Successful treatment of domestic violence treatment could focus on understanding operant contingencies, something to consider, not always considered in domestic violence treatment programs. Got a little time left, so I think I'll cover this section rather quickly. So the crime and delinquency are infrequent in nature. As a result, direct analysis in many cases is difficult to achieve. You might want to look up Tony Biglin. I interviewed him about the good behavior game. I interviewed Brandon Green about neglect and family preservation. He also has an instrument called the CLEAN, which is an assessment. It's a scoring of how to keep the home environment clean, and then how to measure improvement through behavior analytic principles to see if there's been he's got several instruments like that. That's his book there, Dr. Green's Career in the Field of Child Welfare. He's on my podcast. Really good interview. Talked about the clean instrument, and then also a lot of different areas of family reunification. It's the behavior analysis metrics and applications for the preservation and reunification of families. What makes a direct analysis of crime delinquency difficult to achieve? The infrequent nature. Dr. Biglin talked about the good behavior game. Advocated the clean. Dr. Green advocated the use of a clean instrument. For what purpose? I'm going through these quickly. It's, to measure cleanliness in the home. One method to protect children is teaching them to avoid lures, and that is a technique that can be taught. Okay. Generality in forensic settings. So we're talking about the Bear, Wolf, and Risley, and this is applied to behavior analysis and forensics. Generality demonstrated in 3 ways. Behavior change should be durable and maintained over time. Occur in settings other than those in which the program was conducted. And have effectiveness on as wide a variety of behaviors or individuals as possible. Generality should be planned and implemented in potentially 2 types of strategies. They are the reactive and the proactive strategies. So reactive, the intervention can be applied directly in the settings where the behavior change is not occurring. You repeat the intervention across settings until generality develops in untrained settings or for untrained responses. Proactive, the interventions can be implemented in which the consequences vary in kind of frequency. Another proactive is the interventions can to be applied in many different settings to ensure the behavior does not become situation specific. So for there, you may have a juvenile justice, juvenile delinquency programs where you may have a contingency management program to be applied in different settings. It could be in the institution, it could be on home visits, it could be on work, whatever these different settings, so that the behavior change that you do see is not situation specific. And another proactive is the intervention settings might include conditions that occur in non-training settings. So generality can be demonstrated in what way? That it is durable and maintained over time, that it will occur in settings other than those in which the program was conducted, and have effectiveness on as wide a variety of behaviors or individuals as possible. I'm applying this for forensic areas, but this is a lot of different areas to apply generality. So in a reactive strategy to achieve generality, the intervention should be, we're looking for the best answer here, the intervention should be implemented so the consequences vary in kind of frequency. Is that reactive? The intervention should be applied in many different settings to ensure the behavior does not become situation specific. The intervention can be applied directly in settings where the behavior change is not occurring. And D, the intervention can include conditions that occur in non-training settings or conditions. Which one of these essentially is a reactive strategy to achieve generality? So the intervention is applied directly in the settings where the behavior change is not occurring. You react to it, you see where the behavior change is not occurring, and that's where you then apply it. I think in summing up, this is consideration of the ecology of a social problem, solving problems from a systems perspective. And this was a good article. It's written by Joe Cautilli and Kirk Newring. And it's just an editorial work, that crime as a civil rights issue, the role of behavior analysis in protecting American freedom. And if you read this, really one of the strong themes is that when you have criminal behavior, it is an oppression of the victim's family, and the behavior then also harms the perpetrator's family, and the community at large. So that, in other words, crime is a phenomenon that oppresses us all in many different ways. So the authors contend that behavior analysis offers evidence-based effective strategies to reduce crime, incarceration rates, and recidivism, thereby protecting public safety and enhancing freedom for all, because the alternatives may be a restriction in freedom. The current system has led to a rising incarceration levels and enormous costs for taxpayers. Despite goals like incapacitation and rehabilitation, the system has largely failed to prevent future crime, as evidenced by high recidivism rates. For example, 2 out of 3 parolees are rearrested within 3 years. Individuals released from prison face significant challenges, including finding housing, employment, and transportation, as well as dealing with mental health and substance use issues. Specific successful evidence-based approaches would include what's called the community reinforcement approach. That's CRA, Community Reinforcement and Family Treatment. That has the acronym CRAFT. Contingency management programs and motivational interviewing can be included in that as well. Authors argue for the implementation of continuous therapeutic environments in prisons, such as level systems and vocational skill development programs. They call for behavior analysts to become more involved in the criminal justice system. They can serve as expert witnesses, that's amicus curiae, to inform courts about evidence-based practices. Yeah, to be a expert witness is simply to say what you know, and that's you're not taking one side or another. And I don't see it's not unheard of, but I think behavior analysts as expert witness can be very valuable to the criminal justice setting in a lot of different ways. Behavioral science has made significant inroads in analyzing and developing interventions for behaviors like stalking, fire setting, and conduct disorder, as we discussed before. It is argued behavior analysts groups should politically support the use of evidence-based practices in addiction treatment and criminal justice reform to bridge the gap between science and service. So they conclude that behavior analysis can be seen as a crucial tool in addressing civil rights issue of crime by offering scientifically validated methods to improve the effectiveness of the criminal justice system, reducing incarceration, and assisting offenders successfully reintegrate into the community, ultimately enhancing freedom and safety for society at large. Well, I'm getting now, it's been about an hour, and I have some questions here that I think are commonly asked. I'll try and address them just in brief, and someone had helped me out with these before, but this, where is forensic ABA field currently in 2026? What setting context can BCBAs work in forensics currently? I think there's a lot of different areas helping the police, helping juvenile justice, some of the areas we mentioned. You may not be called a BCBA there. You may not be hired on as a BCBA, and it may be helpful to have other kinds of licenses and training. I can't say it never happens you get hired as a BCBA, but it's not common that you may be given another title and then you apply behavior analytic skills. I would look up Rubin's book. There's a few other. He's got another book about case studies about behavioral forensics. How can one become more versed in legal terms relative to ABA that are synonymous with the current language that is being used in the field? Yeah, I would look up Morris's book and also Rubin's, and also there's a lot of information about about assisting the police as behavior analysts to become more well versed. Where to start if you want to enter this specialty? I don't have specific advice for that, but I will say there's a lot of need in social work areas. There's a lot of need in community mental health. There's a lot of need in juvenile justice. What CEs CEs or CEUs, whatever term we're using now, would you recommend risk assessment, behavior skills training, discrete trial training? Our company has some of that. There's some others out there about CEs and motivational interviewing also, if you can get some work in that. Interesting, could ABA used in forensic interviewing? And I think I maybe addressed that in part also on the competency to stand trial, also on the articles on false confessions of how that can be relevant. Are there opportunities to work with law enforcement and training officers working with an ASD population? Yes, there are, and I might get the state wrong, but I think it's Connecticut. They started what they call the Blue Envelope Program. It was a set of criteria for police officers to use in case they encounter a suspect or a witness with autism. It was based off an earlier, I think it was the green envelope if they encounter someone that was deaf. This was a set of criteria if they should encounter someone with autism, because the normal questioning and redirection of a witness may not work the same with an ASD population. Are there any opportunities to aid in current research efforts or consulting? That kind of goes back to some of the articles and areas I spoke about earlier. Okay, now this kind of, I think, takes to the end of what I wanted to say, and I will maybe stop with the sharing and go ahead and listen to any feedback or questions that you may have. Well, I think I think there is training available. The issue with another degree is probably licensure, and that has to do with the employment. Some of these fields I would say we're really, if you can get other licensure, if you can afford it and can do it, or you're starting out young enough that you can do it, I think that could be very useful. But having said that, you know, I do know there's another woman that she consults with the police department in Texas as a BCBA. So I wouldn't say it can't be done, but those other kinds of licensure are very valuable when it comes to getting our foot into the door and then working in these other areas and to practice as a behavior analyst.
Okay, thank you.
So it's maybe good news and bad, but I think it's gotten a little bit, from what I'm seeing, it's gotten a little bit better of applying our work to these different settings. I just don't foresee us being called behavior analysts if these other areas even know what that is. Who knows what we'll be called, but it's a similar kind of thing you might see in education or other areas where, or maybe sometimes with businesses, with you know, organizational management, that they want us to help, but who knows what the title will be. Okay, good question. Anything else? Yeah, risk assessments. The state of the field is clinical psychology would be the tops that would be able to get you into these different areas and to do assessments so that you can become a licensed psychologist in the state that you work in. To do these other assessments, short of that, you may need someone else to be in a consortium with or to sign off on. It depends a lot on your state, what they will allow, and you so know the laws of your particular state, know what their requirements are. Clinical psychologist, either PsyD or PhD, would be the greatest advantage. Other areas, they sometimes allow masters in psychology that are licensed to be able to present information. And to be an expert witness, that's kind of approved by the court. So if you can do it, if you can afford it, and you can look into that, I'd look into the other licensures that would help you be able to practice. Okay, yeah, the risk assessment, there's actually many now, but it was the HCR 20, it's actually HCR 20 V3, and you can get training specifically on that by Hart and some other authors. In the psychiatric hospital, okay, once you're in that envelope under a medical director and a psychiatrist, you can do all kinds of things, and a clinical psychologist director, you can do all kinds of things with their blessing, with their signing off on, that you probably wouldn't be able to do in independent practice. And also, once they are in the psychiatric system, the courts have asked specifically for reports about competency, about progress. So what I could do at that time, when I was under the kind of the oversight of these different professionals, we could do some specific testing about competency. There were for those that have intellectual disabilities, there's an instrument called the CAST-MR. There's another one called I don't know why it's pronounced this, but they call it the ESTR. I think it's the ECSTR. And there's a few other instruments. We could apply those instruments, and we could administer them, rather, get the data, and then that could be merged into a report from the psychiatrist assessing competency. So the psychiatrist would meet with them. Hey, do you know your charges? Do you, tell me about yourself. Do you know what could happen to you? Can you work with your lawyer? And then the data from those tests could be implemented in that report. So that became a very convenient way for me to be able to practice in that setting. And that's what I was referring to earlier. Independently, I've also got a master's, I've got a license as a counselor, and there's been a couple instances where I've been called on to help out. Once again, it's kind of under the blessing or the oversight of another professional. Check your state laws and state rules of how that can be done. So rarely is it the case that I would simply be consulted independently if I'm not part of a body that can support the work that I do. But there were many of us that were in the hospital that did that, and these tests and instruments, they are not necessarily saying you have to be a licensed psychologist. They are saying you have to be trained in psychological assessment. So we met the requirements of the instruments, and we collected the data. It's just a matter of third-party payship, if that's an issue, or legal requirements, if that's an issue. What you saw in there with the graphs and so forth toward the end of that section on CST, that maybe it went by with a little bit too quickly, but that was my own thesis that dealt specifically with discrete trial training just to kind of see, and it would be those with, they were actually diagnosed with autism, with some struggle communication, a type of person that you could see in the criminal justice settings, although they were not in that. But the study was specifically about discrete trial training. Now, in a real life case, what you're saying, I think that's absolutely apt, that you would have some kind of a behavioral intervention, because the problem could easily be, it may not be learning courtroom terms, it may be working with an attorney, it may be distinguishing the prosecutor from your defense attorney. You talk to your defense attorney, you don't talk to the prosecutor, except maybe if you testify, or if you are in court and you see somebody testify and they say something isn't true. You don't just blurt out that they're a liar or something like that. You wait your turn to speak. So there's behavioral interventions that are very apt for these kinds of settings. And what we had in the hospital, we had a lot of mentalistic, a lot of medical model work, where the idea is to alleviate symptoms of a disease. That's the focus of it. And it's like, well, they're incompetent. Isn't that something like, or isn't it the result of a disease? It's a psychiatric disorder, and we're alleviating it with medications or these other treatments. And when their symptoms are less, are they not then more competent? That seems to be the the gist of all of it. In fact, only when I did come across the McCrary criteria, and that's a good set of criteria. And if you look at that, you look that up, it's strongly behavioral. But that's kind of the one shining gem in a lot of psychiatric literature for competency. Interestingly enough, that's what they go to, and that's the criteria that they're using to assess their reports, because that's what judges want to hear. They want to hear, how are they doing in courtroom terms, how are they doing behaviorally, how are they developing skills to work with their attorney, because that's what they want to know. But on a treatment team, you're absolutely right, you would have somebody from nursing, you'd have somebody from social work, kind of the rehabilitation workers, and some psychology personnel. And it would be, when I was there, it was pretty heavily what you would say medical model, and pretty mentalistic in its tone. The legal system itself is strongly mentalistic. You know, when you're charged, they are assessing, did you commit the act, which is what's called the actus reus, and for competency, do you have the mental states? That's the mens reus. That's what the basis of law is when we are found guilty for a crime, that they've met those two criteria. But where is this mens reus, coming from? What is it? And that's where we might diverge from the traditional view of law. We're not, looking for, are they mentally aware? We're looking for, how do they respond to certain stimuli, or what's their learning history? Can that behavioral response be changed through learning? So that's maybe getting a little far from your question, but discrete trial training, in my thesis I applied that specifically. In settings it can be applied in part, but probably with some kind of a behavioral intervention. I wanted to do some more work. It was kind of hard to get these studies off the ground. It was for me anyway. I wanted to do some work on equivalence training. You could easily have them in some kind of a computer setting where they could have the three different pictures. You could have the judge, the defendant, and the court reporter, and then make be able to show, are they able to pick the right one, and then you could do one verbally. Then you could do one simply by audio. You could have the picture and then match it to the audio sound that comes. Any type of equivalence training to make the person more familiar with the courtroom terms that they could do independently. It could be gamified. It could be something where they earn points simply by going through this process. So equivalence training, behavior skills training, and if they're having a lot of behavior problems that interfere with their competency, they can't sit still, they can't listen for long periods of time. That's also relevant, I think. I don't mean to make it purely about discrete trial training, because I think it could be many things. Right. Look up, I can't remember, it was on my LinkedIn account, someone else had another, even more recent article, but that they can progress to a confession. And of course, when you're in front of the police or an investigator of some type, you've been reinforced to agree, and their own pattern of questioning is leading to a confession or some kind of an agreement that will be consistent with the facts as they know them. And that interplay between the two people might steadily lead them to confessing, or they'll say, yes, I was there. Well, did you do something? Well, I might have done something, and then that is then reinforcing the investigator to pursue further. So, all these kinds of interplays between an authority figure and then someone that has been conditioned to comply with this authority needs to be looked at very carefully, and there probably ought to be some kind of an analysis to reduce the possibility that they're simply going to harm themselves by speaking and being part of an operant process where they go into an agreement with the authority figure. So that's kind of a very quick gist of it. But look up that article, some of the others. I think it's relevant to what you were speaking of.
Thank you so much for giving us such a wonderful lecture, and we learned a lot from your presentation. I'm pretty sure our students will send requests to join your Facebook group later after this class, and I will definitely follow the podcast. It's really interesting.
Okay.
Yeah. Oh, thank you.
Thank you. I appreciate having me here. Very best of luck to all of you.
Thank you so much.
Okay. All right.
Thank you.